lateral ankle ligament instability and reconstruction. So basically, there's 3 ankle ligaments on this side. You have 1, 2, and 3. It's not exactly anatomical, but there's one that goes here, one that goes here, and one that fans out in the back. So there's 3. Typically people injure this one and the middle one. The back one people hardly injure. Very rare. So with you had two ankle ligament injury. So what I did was, there's also a revision surgery too. I had to take out some old fixation that was causing the wound to be open. Now the wound is closed now, so we're good. 2 weeks out, everything looks great. Sutures are still in. The wound that was present for 4 months now has actually closed up within 2 weeks. So this is great. Now to go over the procedure that was done, typically if it was not a revision case, sometimes this ankle ligament, if we can find that in there, most of the time it's actually gone, we can't find it. But if we can, a lot of time I just tie these together. But majority of the time what it's done is that there's a little piece of tissue right here on this that's holding all these tendons down on the top of the foot, right about here, right about this area. That is the ankle ligament we attempt to reconstruct. So what I do is I take this ligament here, make you a couple of new ankle ligaments by tying this to the bone. And that's all done without anchors. It's all done with a suture. In your case, because you had a bad reaction to a non-resorbable suture in your ankle that kept your wound open for about 4 months, I use an absorbable one that is not very reactive to you, but still does the job of reconstructing the ankle ligament, as well as putting an amniotic graft. An amniotic tissue graft is it helps to form your ankle ligament. It's almost like a pluripotent stem cell. It goes and adapts to whatever I put it on. So that's why your wound is closed. That's why you're having the results that you're having, and we'll continue on the same track. So basically, I made you a new ankle ligament and put a graft on there to enforce that. And now your ankle looks very stable to me. And how much pain do you have?
I have none right now.
How much pain after surgery?
A little bit after for the weekend, but not that bad.
So this lateral ankle ligament reconstruction is very easy. It's actually not very hard at all. We don't have to get too fancy with anchors or whatnot. A lot of time I can just do is just a transfer your own ligament. Again, is this ligament right up here. For the camera's sake, you get to see that. This ankle ligament, this is the usual rupture ligament, anterior talofibular ligament. So this is already here by nature. It's always here. So take a suture, take this and suture it on to the remaining stump or to the bone of the fibula. That way I can reconstruct one ligament, or I can reconstruct 2 ankle ligaments with the same exact structure without having to cause too much destruction or adding too many things that will cause an adverse or a foreign body reaction in your body. That's why we've had a good result so far.
That's perfect. Very good.
Hopefully I answered all your questions on that.
Yes. One question, where did they have the anchors?
Your anchor from the previous surgery was here.
In that bone?
And in the bone.
Okay.
The reason why I don't use anchors is because of that reason. But that is a valid technique, and it does work really well in some patients.
And that wire was connected between the anchors?
Correct.
I see. Okay.
So,
and that's what you removed was
the wire.
The wire.
I just went ahead and use your own ligaments to reconstruct it, so we don't have this kind of problem.
Perfect.
And as you can see, you're closed.
Yes.
Big difference.
Excellent.